Okay, now that we have you all back in our presence, we will begin with, I think, a workshop everybody is looking forward to. It is our Sex Worker Health and Harm Reduction 101. This is an introduction to supporting sex workers' health and policy. So we have been graced with the presence of Robyn Learned from National Harm Reduction Technical Assistance Center. So if we can muster up the loudest hand clap we can possibly provide to welcome Robyn up here to present to us.
Hi. I want to thank you all for inviting me down today. This is my favorite training to do. Actually, I'm part of the team that developed it with Reframe Justice, Kate Diamato and team over there. And I want to say one of the better sex worker trainings I've ever seen or been a part of. So let's get right into it because this could be a 2 to 3 hour training. So I'm just going to give you the down and dirty, real fast version. So we got our group agreements. I'm sure you've all seen most all of these before. I think the biggest one is, just remember you can say it however you need to. If you don't have words, that's what we can help you do too. And our objectives today, you're going to walk away with an overview of what sex work is, who participates in the sex trade, some ideas on how to address anti-sex worker stigma, and you'll identify some barriers to care for people who trade sex and places to look for more information. We will not be covering a comprehensive or detailed discussion of medical or harm reduction needs, or a working knowledge of trafficking, or legal or financial information, or anything about youth who trade sex. Just to let you know what's going on. So you should have a couple of handouts there. The blank one, we're going to need, or the blank ones we will need for this next little piece. And this is all stuff for you to take home with you so you can go back and review, next week when you're back in the office. So think about the words, narratives, or images, any details that come to mind when you hear the following words. And then just write those descriptions down and on the blank page there. Just whatever pops into your head when you hear sex work. And do the same with street work. Now what images are coming? Or that fun little legal word, prostitute. When you're done with those, let's go to trafficking victim. That's a whole nother set of images, right? Hopefully. And the last one will be survivor. And take a moment, go ahead and go back through all of them, write down whatever comes to your mind. And while you do that, I'll just tell you a little bit about me and where I've come from in this journey. I started consulting with NASTAD 4 years ago, part of their new teaching center. And in January of this year, I got hired full-time as part of the drug user health team. So yay for that. 10 years ago, I had no idea what harm reduction was as a job, right? I didn't realize I'd been practicing harm reduction pretty much my whole life, just in being a responsible user, right? When I first got to Sacramento, probably 11, 12 years ago, one of the first nonprofits I got involved with was a sex worker outreach project. We did a December 17th event, International Day to End Violence Against Sex Workers, and I was kind of hooked. I've been a volunteer with them ever since. So when this all came up, when I started the first year as a consultant with NASTAD, I was on every meeting going, okay, this is great for drug users. What about sex workers? What do you have for them? What do you have going on? And just got loud enough with it that after 6 months or so, they started a every other month phone call for TA support for anybody that wants to learn more about sex work health or about harm reduction when it comes to sex workers, because, you know, not every sex worker uses drugs, right? So we know some of the time they're not even coming into our SSPs to get services. So how do we serve them is what I always asked, until we got to a place where they were able to go and get this training put together for us. And we have this actually as a train the trainer program. So from today, you should be able to get all of the materials and be able to do this training for your own SSPs or for other folks in your departments. Syringe service program. So let's go to all of those words you wrote down, all those descriptions and narratives. Where does that come from, do you think? Right? We know most of it's probably coming from media, or the biggest share of it. Some of those words, I can almost hear the SVU music playing in my head, like, you know, as soon as it comes up. There we go. Other places, colleagues, other organizations, politicians, lawmakers, and advocacy campaigns. Let's hope we're not getting a lot of our visuals from the politicians, right? Because we know they don't have a very unbiased view of it, I should say. In fact, they're some of the best clients. Churches and religious institutions, another good place where the negative images all come from. And of course, friends, family, peers, right? Lived experience. Hopefully we've all at least met someone that can share some of their lived experience if we don't have it ourselves. That's the thing about sex work today, is you never know whether somebody is doing it or not, because it covers such an umbrella of things. OnlyFans, all the different websites that people are using today. You don't even have to leave the house anymore. So we're going to go right now just to this guy. Wait, where'd you go? That 3, okay. And there. No, that's not. There we go. Okay. Getting tricky with that 3-finger swipe. There we go.
I've had many clients sort of want to rescue me, tell me they can help me get out of the work before they know that I'm an attorney, is that I'm multilingual.
Wait. I didn't even look over to the screen. There we go. Now I got it.
That I've lived in 10 cities. Their sort of assumptions about who does sex work is very narrow sometimes. I first started doing sex work in college as a go-go dancer in Tampa, Florida, and over a period of several years that evolved into stripping, the adult film industry, and then later full-service work. My salaries as a public interest nonprofit lawyer were never really sufficient to get a handle on my debt, and so full-service sex work escorting was really able to help me transform my entire financial life. Sex Workers Project has been a leader in the national sex worker rights movement. Many of our clients are transgender women, many are undocumented, many are queer, many are people of color. Sex work, like any other job, whether it's restaurant work, domestic work, construction, being a lawyer or doctor, no matter sort of where in the social and economic hierarchy a job is, all jobs have pros and cons. All jobs can be exploitative or not. All jobs have positive and negatives, right? So we often in society and in the media hear so much victim narrative around sex work, and terrible exploitative human rights abuses happen to some sex workers. But it's important to note that terrible exploitative things happen in all labor sectors, and there's nothing different about sex work other than the sexual stigma and social stigma that's attached to it. When I started, I saw half the people from my gym, people I recognized from the street, from bars, whatever, escorting. I have had clients from 20 years old to people in their 60s, and I've had straight identified bisexual and gay clients, also cisgender and transgender women and transgender men. I've seen so much blatant ageism, what I call body fascism, within the gay male community in particular, that I think a lot of people seek out escorts for that reason. Some escorting is not sexual at all. Some is just companionship based. I'm a Buddhist, very active Buddhist, and I've actually been able to help introduce people to Buddhism who are really suffering with depression and anxiety and help them transform their life. Sex workers provide extremely valuable services to human beings who need them, whether they be sexual services, overcoming sexual dysfunction, sexual anxiety, whether they be, emotional, or whether they be even spiritual. I've had clients tell me that they felt that I made them feel human in a way that they had actually never felt before.
Right? Okay. Hey, it did it. So why does it matter? Right? He just talked a little bit about his own life. I can tell you from my own experience, I've been through a lot of the same experiences with it. Many more times than I thought would happen. There was no sex involved with dates, just conversation. Um, so, as part of that last year and a half ago, 2 years ago now, I had lost unemployment. COVID, right, took me out, took the job out, and worked through all of my unemployment. And I was just sitting wondering how I was going to pay next month's rent when a friend told me, "Hey, I got this thing going up in Chico. You should come up here." I didn't tell you, I made like $3,500 in a month, and I worked 3 days a week. And I had a great time, right? It's For me, it was a whole different experience, but big part of that was because I had somebody who could bring me in at that level with her on different things, teach me a little bit of what I didn't know just being adjacent to sex work for the last 10 years. Big part of what really matters with it, though, is the medical needs that go unmet, right? They didn't even know anything about MPX when I was up there. So within a couple of days, I had both COVID and MPX protocols written out for everybody that wanted to learn about it, right? Because we know that MPX especially transmitted through skin-to-skin touch. How do we negate some of that, right? How do we help people stay safe so that it's not passed through the sheets or whatever? That was all a big part of the work I did up there for a few months. And caring for sex workers, making sure their health is good, has a ripple effect out to the rest of the community. Because if they're in poor health, chances are that could get spread to a lot of people you don't realize, or that don't realize they're being exposed to something, right? We serve people holistically in all of what we're doing, right? That's the new model. And sex work is just one part of somebody's life. Like with our gentleman there, he used it as a way to pay off his lawyer debt from college. I know so many people that are putting themselves through college doing sex work. And like I was saying earlier, it's anything from camming to dancing, all the way to full service. So it's nothing new, right? We know it's the world's oldest profession, but the words and definitions we're using today, those are pretty new. And that's having a real negative impact on something that was already stigmatized and demonized for the last 2,000 years. So let's go all the way back, about 9,000 years ago now, 7,000 BCE, to the worship of Inanna, also known as Ishtar, or Astarte, or Aphrodite. And with all of them, there was sacred sex work, sacred prostitution, it's been called. In most cases, the people were considered priests, priestesses. That's where folks went to get healing. If you came back from war suffering from, PTSD, you went and spent time with a priestess or priest, and they were able to help channel, I guess, healing, facilitate healing for you, whether it was sexual or not. They were able to help bring you back, ground people in their bodies, that kind of thing. There's a lot of debate over how they did it. I personally feel like every person did it differently. That's why there's no way you can know. Kind of the way it still is today, too. It's also all the way through all of Rome. One of the things about Pompeii they're discovering now is that there are so many buildings that you can walk in and see the frescoes up on the walls. They're actually different positions and different people pictured in those pictures. So you could pick, kind of like a menu going into your restaurant. Pompeii actually had to not allow any of the brothels, as we know them today, to be opened before 5 o'clock in the afternoon, because business wouldn't get done. The town was dead when they were open during the day. Everybody talks about how, the Roman Empire. Well, no, actually, it was every city in the Roman and that area all had equal number of brothels. They all had the same kind of work going on, and it was a lot more common than we thought. There we go. If you want to, we got time. It's only 2 minutes. Did you know sex workers actually colonized the West? Well, they call it...
Switch to Chrome to protect yourself from malware, so you can surf without getting phished.
Olmsted'll be here soon. I need a drink to steady my nerves.
Yes, sarsaparillas all around. What? It's good for psoriasis.
Olmsted'll be here soon. I need a drink to steady my nerves.
Yes, sarsaparillas all around. What? It's good for psoriasis.
Now you come on over, my soil dove.
The West is too wild for a frail woman like me.
Unhand her, you brute.
Oh!
Hey, what's the big idea? I'm here to defend your honor. You girls are helpless out here in the West.
Ha! That's a good one.
Blaine, women arguably did more to develop the West than men did.
I ain't no damsel in distress. I'm a working girl. And old Bill loves a good, helpless woman act, don't you?
Oh, I sure do, Miss Pearl. Same time next week.
You got it, honey.
Oh, that punch, that was a nice touch. Now, hold on. Prostitution is no job for a respectable woman like you.
Blaine, women, like everyone else, came to the West for economic opportunity. And despite its considerable downsides, prostitution was often the most lucrative line of work available to them.
And if you haven't noticed, it is the 1800s. And there aren't a lot of options for me to earn a living. This is the best one I got. Excuse me while I decide what to do with all my independence. Now, serving number 42.
In fact, before these women arrived, Wild West towns weren't really towns at all. They were more like work camps.
Welcome, y'all. That's the hole you sleep in, that's the hole you crap in, and that's the hole you die in.
The men were so desperate for women, they would pay just to see a pair of women's undergarments.
Oh, come on. Give me a peek of those dainty little things. Oh, can you imagine?
So when women came west, they saw a clear economic need.
These boys are lacking something. And I think I can provide it.
Their services were in such demand, many of these women made more money than the men they served. And entire towns sprung up around brothels. It was the influx of women that finally turned these barren camps into bustling towns.
Now that we got all this cash, let's do something with it. Cheryl, you open a store to shop in. Marta, you open a school to learn in. Donna, you open a church to feel guilty in.
And with all that wealth, they soon became leaders of their communities.
First you get the land, then you get the money, then you get the power.
And they used that power to provide services the West desperately needed. Madam Millie of New Mexico used her wealth to put local children through college.
How sweet.
Colorado Madam Laura Evans provided workers' compensation for injured men and sheltered victims of domestic abuse.
Mighty generous.
And Madam Diamond Jessie Heyman provided food and clothing to the homeless after the 1906 San Francisco earthquake.
Hold on. You sure women did all this?
They sure did.
Thank you, painted lady, but the men are talking.
Blaine, mind your manners. That's author and historian Jan McKell Collins.
I had nothing.
Oh, hey there, Jan.
Well, hi, Adam.
Would you tell Blaine here about the contribution prostitutes made to the Old West?
Well, certainly. So it is true that the prostitution industry could be a very dangerous one because there was disease, domestic violence, drug abuse, but prostitutes were pioneers, just like the men they served. In fact, a lot of prostitutes and madams were astute businesswomen. Being a prostitute or a madam could actually give women more financial freedom here in the West than their Eastern counterparts. And that could even lead to a measure of political equality and influence in the communities where they served these men.
Well, I'll be a three-peckered barn owl.
Okay, come on, Jan. Double or nothing.
You're on, cowpoke.
By 1869, women wielded so much power in the West that Wyoming actually became the first territory to give women the right to vote, a half-century before the rest of the nation did.
We was hoping on holding elections today, ma'am. That is, of course, if it's all right with you.
Works for me. Girls, time to vote.
Wyoming actually refused to become a state unless women kept that right.
No. We can't have your women voting. Their tiny brains can't handle it.
No deal. We may stay out of the Union 100 years, but we'll come in with our women.
Wow, that is remarkably progressive for this era. Fine, women in Wyoming can keep the vote. By the way, while I'm here, do you mind if I...
Sure, go right ahead, Uncle.
I'm a naughty boy.
Wyoming joined the Union as the equality state, and the idea soon spread. The next 8 states to grant women suffrage were all in the West, and Wyoming would go on to elect the nation's first female governor in 1924. Face it, without these women, the West as we know it wouldn't exist.
So men like me, we're useless? We're nothing?
Okay, that's an overreaction. Saying women are good doesn't devalue the contributions of men.
Oh, horse fucking! Ladies are so great they can take on Big Bad Olmsted. And then be the heroes of the West.
There we go. Got it. Hey, I'm getting good with technology. Not bad for Gen X, huh? How about Wyoming? Who knew? Who knew Wyoming would be that progressive back? I mean, I don't know what happened to them in the 100 years since then, but, you know. A few people you might recognize that you maybe did or didn't know were full-service sex workers before they became known for other things. Ms. Maya Angelou, one of the biggest names. She was very upfront about talking about her past and her history, and it translated into a lot of her art. Then we have Rupert Everett, a new wave singer at one time, actor. I had to look him up a little bit, but I've seen some of his movies. He's, pretty well known. He also did full service escort work. Bikini Kill, The Julie Rain, if you know anything like, I guess progressive. No, it wasn't progressive. It was goth music before goth music was a thing. And then we get Dee Dee Ramone. I didn't know that, and I've been a Ramones fan most of my life until I started putting together some research for this. It's, like I said in the beginning, you never know who you're talking to or if they do sex work or not, unless they have shared that fact with you, right? Even then, still might be. We don't always talk about it. There we go. So harm reduction. We're going to switch it up just for a second. What is harm reduction? Just anybody real quick. Both right. What else? How about one of the first known forms of harm reduction in automotive industry? Headlights. Even before seatbelts, people kept crashing into trees at night. Anything and everything that helps reduce harm in whatever the person is doing, that is harm reduction. So among people engaged in sex work, harm reduction isn't, hey, I have all these resources to get you off the street and change all this. How do you know they want to, first of all, right? How do you know they're not actually enjoying what they do? Some of us do. Also, anybody that is experiencing housing instability, harm reduction could be something as simple as, hey, have you had a shower? Come on, let me unlock the gym for you, whatever it takes. In this context, it's, yes, the definition is a philosophy and social justice movement. What I like is that it empowers each person to make their own choices. Because if we're truly meeting people where they're at, we're not meeting them there so we can take them somewhere else. We're meeting them there because that's where they're at, right? It's not our job to fix that or to take them anywhere. It's our job just to help them navigate where they're at. It's also one intervention and approach within many in the public health modeling, right? There's so many other different avenues of helping folks, but this is the one I think that is the most important to getting to the people that all of those other interventions won't get to. So what is sex work? We know it's the exchange of a sexual or erotic service or performance for material resources. I can tell you the first time I met somebody who I now consider to be a sex worker was when I first came to California. I met my friend's dad, who was 63, and his stepmom, who was 24. And they'd been together for more years than we can legally talk about sometimes. But at 24, she actually owned a house and 3 cars, and her future was set, and she made some choices. I'm like, that's when I started kind of understanding sex work doesn't look like TV shows it. It's not just walking up and down the street. It's not even answering ads on the computer anymore. It can be anything from sleeping with someone just to provide a roof over your head, or to staying in that relationship a little too long because you have nowhere to go, right? There's so many different connotations to it. Some of it is criminalized, but most of it is actually legal. Some is in person with intimate contact. That's what we call full service. And some is remote, over the computer, especially with COVID. So many people went inside, and just that's when OnlyFans exploded. Now we have all these different websites that folks are using. And most of it, they're not having sex with anybody but themselves and making great money, providing a good life for themselves. It can include different forms of physical, emotional, and intimate labor, right? Some of the girls on the camming, they're not really doing much more than talking sometimes to the folks and having conversation, just being there to be a live person, somebody with empathy, somebody with a little love. Whether it's real or not, that's what makes it work sometimes, right? It's kind of the same as acting. A dancer's work is physically demanding, but will have limited intimate contact. Yes, physical contact, because, the lap dances are where the money is, but very little intimate, true contact. While an escort has a range of physicality, and it offers everything from the girlfriend experience, from kissing, from, just wanting to be real close with somebody, all the way to just meeting and having sex in the backseat of the car. It all exists out there, and sometimes you're asked to do all of it for folks. The cam performers, they have very little physical requirements and no intimate contact with clients, but they still take the chance of being online and their face being out there. Because of stigma, it's a chance, I should say. So who are sex workers? It's defined as adults who exchange either sexual or erotic services or performances for material resources, but actually people of all genders, races, ethnicities, ages, identities, both sexual and gender, and backgrounds engage in sex work today. Wrong button. Structural inequity does not affect all of us the same way, though. A good example is to look at Vancouver, who recently, last couple of years or so, legalized sex work. And here's why I vote for decrim over legalization every day, because by legalizing it, they made it to where there has to be permits involved and different kind of requirements through the state, testing, that kind of thing. Who do you think has money to get that done? Right? It's not the girls working the street. It's not the trans women or the trans women of color. It's not the women of color. It's pretty specifically the women who were at the highest end of the escort work. They're the ones getting hired in the brothels. They're the ones getting the permits. And it's created this whole other system where it's still impossible for most of the folks to do the work. Some people trade sex by choice, where they have multiple options to make ends meet, and the sex trade is just the best option. It was that way for me for a few months last year. I made better money in those few months than I had made in a long time, and honestly was having a good time doing it most of the time. But a lot of folks are really out there trading it because of circumstance. They have limited options. Sex work is the one that meets their needs and meets them better than some other things will. But this is what we call survival sex. They're doing it because they need to, not so much because they choose to. And some people trade sex because of coercion, right? We know that they're forced by another person to trade sex, the fear of retribution if they refuse. Now, these people are the ones being trafficked. And many people will have more than one of these experiences, and every one of them is valid. It's just like our perspectives. Over 7.5 billion perspectives in the world, and every one of them's right for that person. So serving sex workers, that's the thing that really has had a lot of people struggling and wondering for a long time. Because the criminalization that goes with it, most sex workers themselves feel pretty unsafe disclosing. It's not like most of them can go to a doctor and say, hey, so I'm doing this and this. What do I need? What do I need to know? A lot of us don't even have doctors. We just go to the emergency or urgent care clinic when we need to. Again, because lack of insurance, all the different things that are the social determinants that keep so many of us disconnected from medical systems. Because of my last 10 years doing this work and working with a trans agency where we did PrEP studies and we had hormone clinics, and I got to know a whole lot of medical students and have something to do with their training. That was kind of fun. But that gave me the ability to go in and be my own advocate with my doctor and be like, hey, so I'm doing this. What should I be doing? I had signed 200 people up for PrEP by that point and hadn't even thought about getting myself on it. It's just part of the disconnect, I guess, part of the, try something new and, oh, wait, now I should do this. I should, I know better than this. And then it was getting also, in there I got immunizations for all of the girls I was working with for MPX at the time, even though the county said they didn't have any. We took them to Sacramento. So anybody across the gender spectrum, trans, non-binary folks, trans men, most every single different kind of person in the world has or does sex work. I say demographic group, not every single person. People of different racial and ethnic groups. We serve these folks best by cultural humility, by remembering they're the experts on their bodies and their lives. And our job is to figure out how best to serve their needs without any judgment, without any coercion to change their life, without automatically assuming they need saving. Parents, pregnant people, caregivers, people in precarious economic and housing, people in, tough life circumstances. How do we serve them well? It's the same thing with sex work, right? Everybody has a different need, and it's how we figure those. See, that's for the 2-hour version, but it's how we figure out how to serve those folks, right? It's knowing how to use pronouns correctly when a trans person comes in. It's knowing how to ask about needs without maybe mentioning sex work, right? We know there's ways of doing it. Like when we're doing HIV testing, you ask how many partners they've been with in the last year or how many people they've had sex with, right? If they feel comfortable enough with you, you'll know. They'll give you a number you wouldn't believe. If you're not hearing those numbers, probably because they don't feel safe enough disclosing that to you yet. We're going to skip that one. So here's some barriers to care as identified by some sex workers themselves. Biggest one is that insurance, the cost. I don't know how many of you realize this, but this is the only developed country in the world that has an entire industry between you and your doctor. Anywhere else in the world, they don't have insurance the way we do, and they don't have this big economic industry, really, taking money from both sides, making doctors' lives miserable, making all of medical staff people really miserable, and then turning around and taking all the money they can from the rest of us out there in the world. Accessibility of services, especially if you don't have an ID, if you're living so far off the grid, if you don't have transportation. The biggest one that nobody thinks about is the hours. If your person is actually doing like street level work, chances are they're up all night out walking the street. How easy is it going to be for them to get in to see you at 9 o'clock in the morning? Right? Unless they stay up that long and don't go to bed at all, which brings its own sets of problems with it. The other big one for a lot of folks is mandatory reporting. If they don't know you won't report them, they're not going to trust that. They're not even going to give you that opportunity. They're going to know mandatory reporting means I can't tell you anything. So why should I even talk to you? Right? One of the things that we had to, not had to, but we chose to teach and model for all of the interns and med students that came through our doors was mandatory reporting is this, but it's defined as what makes you feel like it needs to be, if there's an urgent need to stop because somebody's going to get harmed, yes, but let's talk about how that happens. And let's bring that person into the conversation because chances are they want to stop that, whatever it is too, right? But it has to be done in that cultural humility way, in that way of understanding that we don't even begin to know what that person's life is like. And until we actually have that knowledge, it's not up to us to make decisions. Regardless of what we're taught, how much of everything you've been taught do you follow 100%, right? And I say a lot of that just as my own little editorial in there. The interpersonal barriers, stigma, discrimination, the isolation, right? The fear of being outed to other people, the fear of law enforcement or child welfare. That's especially a big one, especially if the person is doing survival sex. If they're doing it to pay the bills, to be able to provide for their kids, the last thing they're going to want to do is tell anybody what they're doing and take the chance of their kids being taken away. That's happened so many times because of mandatory reporting. Somebody hears something they've done and, oh, I need to report that because those kids are in danger. Well, the kids aren't. You don't even know that. You haven't seen how she interacts with them. You can't assume it because she's doing sex work, or he, just like you can't assume the gender of a sex worker. It's remembering that these are people in individual circumstance. And I would ask, how do you better facilitate getting that rapport so they do trust you enough to talk about this stuff and know that's not going to happen? Oh, I guess I got a little ahead, because I'm talking about dismantling already. But I can't see a barrier without thinking about dismantling, so. Now look at some of these interpersonal, right? Some of the dismantling is the same thing we do in other communities, same thing we've done with other work, as far as partnering with community-based organizations that are from that community, made up of people in that community. Instead of going out and trying to reinvent the wheel for your own office, why not partner with them and learn what you can from them? Let them guide the conversations. That way you can better go back and change your organization, right? Change that stuff from inside, get some of that loosened up so that you can better serve everyone. And especially in the HIV and viral hepatitis world of prevention, sex workers are that demographic that isn't even being talked about in the year where we're recentering populations that have never been centered, right? NASTAD this year has the chairman of our board. Every year, the new chairman puts out a challenge for public health departments who are the membership of NASTAD and for anybody working at NASTAD. This year's challenge is recentering key populations. HIV and aging population is one, people who use drugs, men who have sex with men, but aren't necessarily how do I put this? Yeah, it's like MSM of color is one thing, but how about just the men who love men who don't talk about it, right? So that's one of the other big key populations. And then the trans folks at NASTAD this year said, well, how do we recenter the trans population when they've never been centered? Let's center them first, then we can recenter later, right? So those are the populations this year NASTAD is concentrating on. But even within that, nobody's talking about sex workers, except me and one or two others. But then we have the interpersonal stigma reflecting our own interactions. That's where it starts. How do we feel about it? What words came up for us in that beginning exercise? And how do we make sure that we're having more of a better image in our heads when we talk about sex work or street work or any of that stuff, so that we're not stuck in our own stigmatizing and not even realize? It's so prevalent in all of the media that it conditions us right from the beginning in most cases. I know for me, it even took a lot more work for removing some of those things in my brain than working with trans folks, than working with people who use drugs, than even working with people unhoused. It's some of the biggest stigmas around are still around sex work. I have been, like I said, working with SWAP for 10 years, but always kind of had this place in my head where I've never actually done it. So not a superiority, but kind of, yeah, if I'm going to really own it, I've never done that kind of thing. That's one reason I pushed myself to do it last year. That and because I needed some money, and my friend was like, hey, yeah, we're going to go do this. And it sounded like a good time. So, I'm glad I did, though, because that's when I really saw some of the stigma still left in my own head and some of the things I still needed to work through. Some of the interpersonal barriers. So what does rescue or rights not rescue mean? Rights not rescue. What do you think I mean when I'm talking about that? Put the white horse back in the barn. Take off the captain, so save a hoe cape. What do you think about when we talk about the sex worker community and sex worker-led organizations? Do you know of any? Is there any here in San Jose? Have you worked with any at all? Right? If you haven't, if you don't even know of any, there's some homework. When you leave today, go look up a few, see if there is any here, and maybe see how you can best work with them, or at least reach out and ask them what they do. Find out if there's ways you can do warm handoffs or cross-collaborate. And I know San Francisco has just lost one of the biggest and oldest, St. James Infirmary closing. But there's still 3 or 4 others I can think of that are operating. There is some movement at a national level of decriminalization conversations happening in multiple states. And like I was saying a minute ago, that's where this should actually live, in decrim, because it's not something that needs to be so heavily criminalized. If you decriminalize sex work completely, you're going to find trafficking will come to a halt in a year or two. You know why? Because the sex workers want to be talking about that with cops more than anybody else. They don't like seeing the kids getting exploited out there like that. Some of them, that's where they started. They know what it's all about. They don't want that. But do they feel safe going to report it to the cops today? No. Why? Because if they don't get arrested for it, they might just end up getting raped for it. That's a real thing. For many years, there was a group of law enforcement who was going around raping sex workers for 10, 12 years. And everybody knew it, but nobody talked about it at a level that they could do anything about it until just, I think, a couple of years ago, they finally made some arrests and shut it all down. But that went on for a good 10 or 12 years in Oakland. And it was, I mean, if the true nature of how many and how horrific and how violent those crimes were ever came out, Oakland wouldn't be the same, ever. Like, I've talked to some of the girls that have survived some of that, and it's worse than any crime I've heard from the sex offenders that we're so afraid of that are on a list, you know. So engaging with sex worker community, serving organizations directly, one way to do it, maybe see who's doing a December 17th event and start by just going and showing your support. Most places that I know will have at least an in-person meeting and discussion, not so much discussion, but just a memorial kind of thing, talking about how many women or men we know of this year that have been killed. The whole thing was started 20-something years ago, 30-something, in the 90s, after the murder of Rita Hester. And it was all part of the Green River Killer. This guy was estimated to have killed he was charged with, I want to say, 30-something crimes, but they estimate hundreds. And he knew he could get away with it because he was killing sex workers. Half the police reports came in with the cops making a note, no human involvement. That was a description of the victim. No human involvement. Seek out sex worker-made media. Listen to the diversity of stories and experiences. There is so much out on YouTube right now. There are so many different channels with a whole lot of videos like I just showed you. These were the only 2 or 3 minute ones I could find. Most of them are hour, 15 minutes to an hour, hour and a half, and they're full-length stories. American Courtesan is a really good, professionally made 2-hour documentary that is made by one of the women who founded SWAP. In fact, she's the ED of Sacramento SWAP still. It's a great depiction and it's a great portrayal of her story. In it, she also talks to a few other people that have been in it for years. They give their stories. There's so many ways of doing it. You don't even have to seek out a person in real life, right? You can do it online, and it gives you the same kind of experience, but without the empathetic, I guess, connection that you would get in person. And again, think about rights, not rescue. Trafficking victims need rescuing. Anybody doing the work, there's a good reason why they're doing it. Find that out first, and then find out if they want you to help them get a different path. Most of the time, they don't want or can't afford to take another job, because how are you going to go to making $15 or $20 an hour when right now you're making $150 an hour? Actually, yeah, depending where you're at, it could be $300 or $400. And borrowed from the disability movement, again, nothing about us without us. If you aren't talking to people actually doing sex work, then you can't really learn how to interact or how you can best go from being an ally to an accomplice or even co-conspirator, right? And I would recommend looking up those 3 words. There's actually a great one-pager on it that gives you the best definition. One of the things I loved is she talks about, you can be the best ally and not actually do anything. Just stand. That's what a lot of allies do today. Co-conspirators, they're out there asking, how can I show up for you? How can I help make this better? Right? getting involved, but not trying to take credit for it, not trying to take over the movement, like we see in so many of the different social justice causes today. So in health department programming, this is the fun one, y'all. To what extent do you think sex workers' needs and experiences are represented in your department or in infectious disease or harm reduction? Is it implied? Or do you have explicit ways and means of working with folks? Good question. Feel free to throw an answer out. Mm-hmm. Mm-hmm. Right. That's that's where a lot of it usually lives, right? Different variations and forms of that. What about when a person comes in for their once a year testing, their once a year physical? Are you asking them, would you like all of the tests? And, we recommend at least once a year you get checked for everything, because not everybody's going to tell you, yes, I want those tests. Sometimes they don't want to know the answer. And it's at that time that you can better engage with folks without directly asking, hey, are you doing sex work? Right? Because this same questioning, the same line of communication should be happening with every single person coming in your office that you know is having an active sex life and over 18. Like we said in the beginning, you can't assume who's doing sex work and who isn't. So ask everybody. Mm-hmm. Good. Awesome. Awesome. Does your outreach go to massage parlors? Not yet, and when it does, that's where you're going to find a lot of trafficking. But just my observation. So it sounds like you have some good programming already in place. That's where a lot of the survival sex workers you'll find coming in. A lot of the street-based sex work folks will get caught, not caught, but I mean will be able to access care through, especially through outreach. But your $300 an appointment an hour kind of escort, probably not so much. That's why I was telling you, ask everyone coming in. If they're over 18 and they're having sex, ask them, hey, do you want this testing today? And while you're asking them that, you can start asking some of the other questions like that go along with the HIV testing or viral hep. Do you feel comfortable talking about your own experiences or talking in a way that is going to help the person coming in to see you feel comfortable telling you their experiences? Because if you don't feel comfortable having that conversation, there's no way they're going to. It's kind of the same way as working with trans folks, right? You have to make them feel comfortable before anybody even opens their mouth. Do you collect or track any of the data that pertains specifically to people trading sex? How is it used? How is it protected? What kind of information would be helpful or be actionable? What kind of information would help with grant writing for some of your or some of your community-based programs? And which partners or organizations do you talk to if you have questions about sex worker health? If it's just me, look around in your local area, because I guarantee you there's a sex worker organization. And even if you don't go and sit down and have like an MOU with them, just even having a conversation so you know who the person is. Warm handoffs are a wonderful thing. Now we get into like co-conspirator territory, collaborating. Name people who trade sex as a priority population. How is it that this has still not been done? And I'm asking that rhetorically because I have been volunteering with the State Office of AIDS planning group for 7 years now. And I'm proud to say that when I got there, it was all people on county and jurisdictional planning bodies. Now it's a community-based planning body. We have more community members than we actually have planning body staff from different jurisdictions. When I first got there was 2 people from community and 16 from jurisdictions. It's been a big change. But even there, in this year's plan, we don't really talk much about sex workers. And a part of what they say is because sex work overlaps into every different area that we're talking about for priority. But I think it still needs to be called out and named independently, just like we do with everything else and everyone else. Expand allowable harm reduction supply purchases to include more than the cheapest condoms you can possibly get that nobody ever uses. Right? We wonder why we end up with so many Trustex going bad. Would you buy Trustex to use for yourself? Any of you? Have you ever used one? Usually it takes 2 or 3 to find one that's not going to break, first of all. They suck. But they're cheap. They're what the state gives to the counties. They're what the counties can afford to buy. Spend a little more money, get the good ones, and watch how fast word gets out in the community and how many more people are coming to talk to you now. Just that alone, making sure there's lube, making sure there is all the supplies, is enough for most sex workers to come and seek you out. If they hear you have things for them, like the infinity condom or internal condom, we call it, they're gonna love that. If you have, like in Sacramento, we do a supply thing every December 17th, where we'll give everybody coming in a backpack full of hygiene stuff and like full bottles, not travel bottles, and socks and leggings and menstrual hygiene stuff. Everything that a person would need out there on the street, we have it for them, just all in a backpack. Here you go. And it costs SWAP a little bit of money every year to do that, but it also lets them know, hey, we got you. We're going to do what we can to take care of things. That goes a long way to letting folks know that it's a safe and affirming, open place for them to come. Dedicate funding to community-led organizations, including programs led by people with experience. Offer institutional support, like fiscal sponsorship, like maybe mentoring in how to be an ED for an organization, right? Maybe helping facilitate the beginnings. It's the same thing I talk about with trans-led organizations, or bringing trans folks on planning bodies. Sometimes you have to facilitate that more than you would with other populations. Got to remember that 2 hours that person is taking out of their day to come and see you just costs them somewhere in the neighborhood of, a few $100 to a few $1,000s. And this is the big one. Same thing with all of the groups that we work with. Compensate the experts coming in to talk to you. If you're asking somebody for their emotional or intellectual work, pay them for it, right? help them get the training they need to feel comfortable in those spaces. I was blessed enough to walk into the planning council and be able to just jump right in. I'm also a challenger in a team setting, challenger and communicator, both equal measure, and confident enough that I can throw out there, hey, your 2016 plan looks great, but it's dead in the water. It's not going to work at all. This was in 2017, I told them that. Because they didn't mention trans people, they didn't mention people injecting drugs, and they didn't mention sex work. How are you going to get to zero if you're not even thinking about those three groups? And here's some resources, some places you can look up. Take out St. James. Well, actually, there's still some folks still there that can pass along. Reframe is one of the better ones up here. And I know of, I want to say, 2 different organizations now in the Bay that are picking up some of the programming that was housed at St. James. I will make sure I update this and send it, put that resource in here before I send this to you next week. Any questions? We have, yeah. There are a couple. One of them is one of the city council people in San Francisco. I think there's actually 2 of them working on a decrim bill right now. And we're in the process of recruiting a couple in the state level. Being in Sacramento, I get to help with a lot of that, whether I want to or not sometimes, but voluntold thing. So yeah, I'm not going to share names publicly, just because it's not anything that has gotten to that stage yet. But yes, I am also working with people in 7, 8 different cities now around the country, that all different states where we're working on trying to get local and state decrim bills passed. Yeah, go ahead.
The Q Corner, we launched a harm reduction project to focus low barrier access to substance users and sex workers for naloxone access, fentanyl testing strips, and come on in. If we don't currently do HIV STI testing, but we partner with the Sharps team that Monica said, so we have access, to get folks care, physical, mental health care, substance use care, and we have naloxone on our table back there. So please grab some on your way out. We can train you. We just want to put that word out in our county that's where we're starting from the ground up. So thank you so much for your presentation.
Thank you.
Hi, you mentioned college students, and so I'm curious to see if you have seen any good models around there of community colleges or universities doing in-reach among their student populations in terms of their social or medical needs.
I have not. Not to say there aren't any, just I have not personally seen any. Most of the colleges I've had any experience with, it's more of we have condoms. And beyond that, we don't want to know. I will say one quick thing I learned along the way. If you have condoms, separate them. Yes, it's a little bit of work, but volunteers can help with this. Folks that, just need something to do for an hour or 2, separate them so that you have your larges, your extra larges, you have your smalls, you have them separated for folks so they can just go in and grab the ones they need and not have to take a bunch that they're not going to use. Makes a big difference.
Thanks again. I also wanted to bring up, I'm so glad you brought up massage parlors. And this ties in with, because I'm part of a community that language and cultural wise is really separated from the white mainstream way of, I guess, functioning, And so I often wonder, are there groups that, because I know in San Francisco, we used to be called API Wellness Center, now it's SF Wellness Center. They have specific folks that have the lived experience and can speak the languages, to address the fear and so forth. And I'm not sure about Santa Clara County. I mean, I hear about bus in the east side, that's where I'm from, but I don't really see outreach workers, talking to unhoused Vietnamese and, the sex work that goes on in those little cafes that are around my neighborhood. And so I just wanted to bring that up. We talk about racial equity and health and so forth, and I'm glad that I'm hearing these low barrier, but we need to really push ourselves to really center around who are the folks that are living with these experiences, and do we have the staff, or are we working hard to get the funding, get the policymakers, get the programming to reach them and to include them?
Yep.
So that's been my
Absolutely.
experience with the HIV/AIDS work, and I know it's really helped inform me. But I just wanted to really bring that up. That frankly, the immigrant, underground Asian communities are really underserved, and they still are underserved. So, I don't know how we're going to whip it around to really work with them, other than through criminal incarceration and bus.
That's why that is such a popular model right now, because that's a lot of the parlors, especially, you can't even get into unless you have a warrant a lot of the time. And you can usually tell the legitimate massage places from the not so legitimate by how well can you see in the lobby? Are there bars on the windows? Do you see employees coming in and out at the end of shifts? Right? Think about those three things when you see one of these establishments, and that'll answer your questions right away. If you're not seeing employees come out, that means they're living there. That means they probably can't come out. But again, private property, how do we prove that? It's one of the things that makes that whole conversation so challenging. Absolutely. Yeah. Mm-mm.
Serve as well, not just health needs, but behavioral health needs as well. And that's AACI.
Nice.
Thank you. One more time. Asian Americans for Community Involvement.
So one last thing real quick. What's your biggest takeaway from today? Take 2 or 3 people, and then we'll call it. Or 1 or 2 people? Yeah, good.
Oh, yeah. Anybody, just raise your hand and I can run the mic over to you. Or I can volunteer people. 3, 2, 1, telling.
How'd you know? I have taken a lot of notes. Lauren, thank you so much. This was really amazing. I mean, I really didn't understand that sex workers are not a priority population. I mean, that was, to me, like, aha. So thank you for that. It was very basic.
Anyone, volunteering on this side. Oh, perfect.
Hi, I do like to, I'm Brendan, hello. I do like to acknowledge, as you pointed out, that reporting requirement, from service providers. As a mandated reporter, I do make my mission to let that be known up front, but I do recognize that it's going to shut off some of that conversation out of fear of what's going to happen to it. But I like what you said, is that it's your understanding in that context of harm, because having been on that front end investigation, I've received reports where I'm like, this shouldn't have been something, this is a disclosure to you, but where is the risk?
Right.
And it's created a lot of more issues for youth and for families. So I do think that as professionals ourselves, we should take into more training on how to assess those reports, because they can create larger issues than what you're looking at. Because I mean, that can disrupt a family's livelihood, that can disrupt abilities for children to care of themselves, it makes bigger holes for them. So I think as professionals, if we are professional in this room, being trained on mandated reporting and how to assess that, I think is a really important part for us in our competencies. So thank you for acknowledging
Absolutely.
that.
Yeah. One of the ways we found that helped with that is taking someone along who is not a reporter and having them have the first conversation. Then they can come back to the mandated reporter and be like, okay, they're wanting to talk about this and this, but don't ask about that.
All right, one last person. I believe we have time.
I really liked hearing about how there are all the non-intimate sex workers. I'm a member of a few kink communities in the area, and listening to the presentation made me realize that the people who set up those parties are essentially sex workers, and they're hiding too.
Mm-hmm. Absolutely.
Do we have time for one more, or?
We've been on time up for like 5 minutes, so.
Okay, we will no longer stand between you and your food. But before we go, I would love everyone in the room to just stand on your feet and give a large round of applause to Robyn. And you all don't know this, but our office is very grateful for having Robyn here with us today. It took a lot of work to get someone to come today to be willing to have conversations surrounding sex work. They seen Office of LGBTQ Affairs, but then they also seen government. They seen county. And they were resistant to being willing to come today to have these conversations and share this information that we all need in order to continue to keep everyone in community safe. Not just certain populations, we all matter. So to have Robyn, and we were first like, oh, we didn't get anyone. And when we were about to just give up on the conversation, Robyn, we seen the email, oh my goodness, we got someone. Okay, whatever we have to do to make this work, we're gonna do it. So we really appreciate you, Robyn, for being here with us, because this was not heavy in the sense of a lot of work, but it was heavy in the sense of toll and being able to get folks willing to come out and have these conversations that are much needed, but afraid of backlash or stigma because we are a government agency.
That's
so
part
thank
of
you
why
so much.
I'm not here as a NASTAD employee today.
Yes,
I took
thank you so
vacation
much.
day.
Yeah.
Because, things with the CDC right now and with not knowing funding next year. I get it. I understand. But also this has to be done, so.
Yes. Okay, let's give Robyn one more hand of. So if you're curious to know, lunch is on the other side of this wall. If you go out, make a left. You can go in through those two doors. If you need a vegan or vegetarian meal, please come see me. I will give you a little ticket to retrieve that from the servers over there, but feel free to go on across the hall, take a seat. They have some great food for you all, water already waiting, and enjoy your lunch.